Hello, I'm a marriage and family therapist, licensed to practice in California, and I'm also a life coach. My name is Renee Haas, and today I'd like to talk to you a little bit about some things you might want to consider if you're thinking about using your health insurance benefits to pay for visits to a mental health professional, such as a marriage and family therapist, a psychologist, or a psychiatrist. And initially you might be thinking to yourself, well, I've got my insurance, why shouldn't I use it? And that's perfectly understandable. I know I'm certainly grateful for having insurance when I need to go to the doctor or the dentist. But it gets a little bit more complicated when it comes to mental health care because unfortunately some people still attach a stigma to psychological conditions. For example, people might look differently at a person who has a physical condition, such as a thyroid disorder, versus a psychological condition, such as major depressive disorder. And the reality is, if you want your insurance company to pay for visits to a mental health professional, that mental health professional must provide you with a quite serious diagnosis in order for the treatment to be covered. For example, some insurance companies won't pay for couples counseling. They won't pay for what they consider normal bereavement after the death of a loved one. So your mental health professional has to find a serious diagnosis that legitimately describes your situation and that the insurance company will find serious enough that they will pay for the treatment. But once you have that diagnosis, the issue becomes confidentiality. Now, if you're a self-paid client, if you go to a therapist and you are paying for it out of pocket, virtually everything that the two of you talk about stays in the room. There are a few exceptions. Your therapist is required by law to report things like child abuse and elder abuse. And there's a few other issues that are either legally required or required by the professional's ethics code that needs to be reported or dealt with in some manner that takes confidentiality out of the picture. But the vast majority of the time that you spend with your therapist or other mental health professional, what you talk about just stays between the two of you. And that creates an environment where you can be more open and honest about some of these really serious, painful issues that brought you to therapy in the first place. Now, if you're getting your insurance company to pay for your sessions, though, that confidentiality is no longer in effect because your diagnosis is part of your health record, and that could be detrimental to you in the future. For example, let's say you have major depressive disorder, which is a very common diagnosis. Think for a minute about how other people view people who they know are seriously depressed. They generally have certain expectations of how depressed people behave. So that could affect your ability to get a job in the future. It could become an issue in, say, a child custody battle or some other legal issue, since law enforcement agencies do have the ability to look into people's health information at their discretion. And it could also become a problem for you in the future if you tried to obtain other health insurance or life insurance. So those are just a few examples of situations where having a significant mental health diagnosis could be problematic in the future. The other thing that becomes a little bit problematic sometimes when you're having your mental health care covered by your insurance company is that insurance companies can place limitations on your care. Some insurance companies are very generous and they don't really interfere in the therapeutic process very much. Others put limitations on, say, the number of sessions you could have per year. And once you reach those sessions, it really might not be adequate to have resolved some of the serious problems that brought you to therapy in the first place. But those sort of pragmatic issues of trying to get your health insurance company to provide adequate mental health care pale in comparison, in my mind at least, to the confidentiality issue. I really believe that confidentiality is the number one thing you should be thinking about when you're considering using your health insurance for mental health care. So I hope you found this information helpful, and if you'd like some more information about me, feel free to visit my website, www.reneehaas.com. That's RENEEHAAS, and I wish you the very best of luck in obtaining the help that you need. Take good care.